Imagine skin as fragile as a butterfly's wings. This is the daily reality for people with epidermolysis bullosa, or EB. For these families, one treatment is non-negotiable, and it can cost upwards of $1,000 every single month. This isn't a simple procedure. It's a daily ritual that can consume 3 to 4 hours every single day. And for parents, it carries a heavy psychological toll, as they must inflict necessary pain on their own child to keep them alive. Today, we're breaking down why this single daily regimen of wound care is the one treatment that defines life with EB. So, what does this daily battle actually involve? It starts with the fundamentals: bathing and complete dressing changes to protect fragile skin and prevent infection. A proactive step is lancing every new blister once it reaches the size of a dime. This prevents the blister from spreading and causing larger, more dangerous wounds. But counterintuitively, the top layer of the blister is left in place after draining. It acts as a natural, biological dressing, protecting the raw skin underneath. Underneath this entire process is one stark reality: pain. For many patients, the daily removal of dressings is described as excruciating, causing significant distress. Historically, pain management for this ordeal has been a massive challenge. Some patients have experienced severe pain without adequate medication, a gap in past treatments. So, why endure this painful process every day? Because the constant presence of open wounds makes patients highly susceptible to systemic infections. This routine is a lifesaver. But if the skin is that fragile, why not use simple bandages from a pharmacy? The answer reveals the hidden damage that standard medical supplies can cause. The mechanism is simple. Traditional adhesives stick to and rip off the fragile top layer of skin. This doesn't just cause pain, it creates entirely new wounds. Because of this, EB care requires specialized, non-adherent materials. These dressings are engineered to protect the wound without sticking to the delicate skin surface. So, the dressing choice isn't about comfort. It's a necessary medical intervention to prevent further injury. This is why the supplies are so specific and so expensive. This daily care is also mandatory because for many, wounds are chronic. They exist in a constant cycle of partially healing and breaking down again, making it a lifelong strategy. We've seen the process, the pain, and the materials. But who bears the weight of this daily burden? Let's look at the real-world impact on families. First, the clock. As stated, 3 to 4 hours per day. That's 28 hours a week, the equivalent of a part-time job, but with no days off. Then, the cost. Up to $1,000 a month, often exceeding insurance caps. This forces families into impossible financial situations and constant battles for coverage. The result? Caregivers become self-taught experts. With limited professional support, they learn to interpret cries of pain and manage complex symptoms on their own. This expertise comes at a heavy emotional price. Parents describe feelings of guilt, powerlessness, and anxiety from the daily act of causing their child necessary pain. This relentless routine clearly dominates the home. But how does it ripple outward into every other aspect of life? The impact is far broader than skin and bandages. First, nutrition becomes a vital part of wound care. The body needs massive calories and protein to heal skin, but painful blisters in the mouth make eating difficult. The rigid, hours-long schedule also severely impacts social life. Spontaneity is impossible. Vacations and parties require complex planning around the wound care routine. Further complicating things, there is no single best dressing. The right product changes based on the type of wound, its location, and even the patient's preference. This high degree of personalization is why the caregiver's self-taught expertise is so vital. They become masters of a complex inventory of supplies, adapting treatment daily. So let's connect these pieces. How do the medical facts and the human costs combine to prove the central idea of this daily regimen? The excruciating pain of the routine is the direct source of the caregiver's psychological burden. This transforms a medical act into a daily emotional trial. The crushing financial cost isn't arbitrary. It's a direct result of the medical need for non-adherent materials. The high price is linked to the skin's fragility. Therefore, this daily wound care isn't just a treatment for EB. It becomes the framework of life itself. It dictates schedules, finances, and family dynamics. With such an overwhelming daily burden, is there any hope for change? Fortunately, new developments are directly targeting the heart of this routine. New treatments are emerging, like spray-on wash-off bandages and gels made from birch extract. These aim to reduce the pain, time, and frequency of dressing changes. By targeting the daily dressing change, these developments aren't just improving a symptom. They are giving back time, money, and emotional energy at its source. Until these are widely available, the daily wound care regimen remains the singular foundational treatment EB families rely on, a demonstration of their incredible resilience. You can help. Support organizations funding EB research, advocate for better insurance for necessary supplies, and share this video to raise awareness for these families.